Good afternoon, everybody. मैं आ गया, रीडिंग रूम को आ गया. What is the most sleepy subject, doctor? Microbiology. आज हम 10 to 15 minutes में the most crucial topic of microbiology के बारे में फटाफट रिविजन करेंगे, ठीक है यारों? This is Dr. Murli Bharadwaj. Today is September 9th. Another 14 weeks of time is there, golden time is there for the preparation for the NEET PG. Let us make a start. Enterobius fecalis. Enterobius fecalis. It leads to intra-abdominal sepsis. What is special about it? It grows in the presence of 6.5% NaCl. Salt मिला के नींबू का पानी पिलाए तो एंटेरोकॉकस फिकालिस काम करेगा. इट ग्रोस वेल नमक के साथ 6.5% NaCl and arginine. Enterococcus fecalis. It is bile esculin hydrolysis which is positive. So 2 points about it. Enterococcus fecalis. Bile esculin hydrolysis is positive. How will you remember? भैया एंटेरो बोले तो गट है, गट बोले तो बाइल है, बाइल बोले तो हाइड्रोलिसिस पॉजिटिव है. That's how you can remember. Bile esculin hydrolysis positive for this gut organism Enterococcus fecalis. Now, a patient of rheumatic heart disease develops infective endocarditis. दांत का डॉक्टर के पास गए, डेंटल एक्सट्रैक्शन किए, बाद में रूमेटिक हार्ट डिजीज, पेशेंट को इन्फेक्टिव एंडोकार्डाइटिस आ गया. सो डू यू वांट टू सू द डेंटिस्ट? नो सर. सो डेंटल एक्सट्रैक्शन leading to infective endocarditis, you should think of viridans. Now, commonest organism leading to cellulitis, swollen limbs, cellulitis, Streptococcus pyogenes is what you need to remember. Streptococcal toxic shock syndrome में virulence factor क्या होता है? Pyrogenic exotoxin is the one which is the virulence factor. अभी आ गया a very important question. Tomorrow NEET PG 2020 में एग्जैक्टली डिक्टो यही क्वेश्चन आए तो मेरे यारो मुझे बदनाम मत करो, राइट? हाँ, क्लिनिकल विनेट इन नीट पीजी, व्हाट इज दैट? क्लासिकल वन, मेनी टाइम्स आस्क्ड इन द एंट्रेंस. A 3-week-old child presented to the pediatrician with meningitis. Okay. A presumptive diagnosis for a late onset perinatal infection was made. The CSF culture was positive for the gram-positive bacilli. Now, the question is, that kind of a perinatal meningitis can be because of either Listeria or Streptococcus agalactiaceae. So, how will you differentiate Listeria from that of the Streptococcus agalactiaceae? भैया ये लिस्टेरिया जो होता है, लिस्टेरिया typically is a motile organism. Motility at 25 degrees is Listeria, right? Now, what is the similarity? First of all, why we should get confused between Streptococcus agalactiaceae and Listeria in a case of the perinatal meningitis? हिप्पुरेट हाइड्रोलिसिस, दोनों हिप्पुरेट हाइड्रोलिसिस करेगा. कैंप रिएक्शन पॉजिटिव रहेगा, दोनों को रहेगा. दैट इज द रीजन वी आर कंफ्यूज्ड. बट व्हाट इज द डिफरेंस? ए नेगेटिव कैटलेस टेस्ट and the chaining in the broth, that is a presumptive diagnosis of Streptococcus agalactiaceae. Whereas motility at 25 degrees Celsius, resistance to furandantin, that is indicative of Listeria monocytogenes is what you need to remember. Now you know little मुन्ना को meningitis किसके वजह से हो गया, Listeria or Streptococcus agalactiaceae. Now doctor, alpha hemolytic colonies whenever there is an alpha hemolytic colony, it can be viridans or pneumococci. Viridans or pneumococci. How will you remember? Pneumococci means Drotsman's colonies. You know the term Drotsman colony. ड्रॉट्समैन भी ऐसा ही होता है. और यहाँ के वी है ना डॉक्टर, दिस इज विरिडांस, right? Viridans, and this part of the alpha, right? You think of the Drotsman colony. एक शॉट में 2 birds खत्म. Now doctor, how do you differentiate? थोड़ा बट्टी मारने वाला मौका आ गया. कैप्सुलेटेड लैंसियोलेट डिप्लोकोकाई वो होता है न्यूमोकोकाई. ओवल राउंडेड chain is viridans. Lung test, capsular swelling, that is typical of pneumococci, which is not seen in viridans. Viridans are naked, कपड़े पहनते नहीं, मगर pneumococcus एकदम सूट ब्लेजर पहनता है एंड वो उठ के दिखता है. That is Lung's positive. Colonies, they are dome shaped with Drotsman is pneumococci, only dome shaped is viridans. Uniform turbidity is pneumococci when you grow it in the liquid, whereas granular turbidity with a powdery deposit होता है viridans. अभी आ गया very important डॉक्टर, जियो मालूम है ना, जियो रिलायंस जियो मालूम है ना. बी होता है बाइल सॉल्युबिलिटी, आई होता है इन्युलिन फर्मेंटेशन, ओ होता है ऑप्टोचिन सेंसिटिविटी. बियो विल बी टिपिकली पॉजिटिव बाय द pneumococci but negative by the viridans is what you need to remember. Now intraperitoneal inoculation in the mice, pneumococci को दे दिया तो माइस मर जाएगा, मगर विरिडांस को माइस में लगाए तो विरिडांस मर जाएगा, माइस नहीं मरेगा. इट इज नॉन पैथोजेनिक, whereas fatal infection is caused by pneumococci. समझ में आ गया ना? At least what is the difference between pneumococci and viridans? At least you understood now what is common between us and the mouse. मौसी मर जाएगा, हम भी मर जाएंगे अगर pneumococcus आ गए तो. That is the fundamental difference. अभी फटाफट next question about streptococci which is going to come in NEET PG 2020 paper out. A patient is admitted to ICU. He is on central venous line. Last 1 week, my God, nursing home वाले रोज 1 लाख बिल दिया और 7 lakhs हुआ होगा अभी तक, right? He is on ceftazidime. He is on what? Ceftazidime and amikacin. After 7 days of the antibiotic, he developed a spike of fever. And the blood culture is positive for gram-positive cocci, which are in chains, and it is catalase negative. Following this, vancomycin was started, but the culture remained positive for the same organism. Even after 2 weeks of therapy, vancomycin useless. Now comes the question, what is the most likely organism causing this kind of an infection, which is typically gram-positive cocci in chains, which is catalase negative, which came with the ICU on central venous line? You should think of Enterococcus fecalis with all that history. याद रखेगा ना? Enterococcus fecalis. Now doctor, a infant has a high grade fever, respiratory distress at the time of presentation to emergency room. Oh my God, little मुन्ने को क्या हो गया? मुन्ने को pneumonia हो गया डॉक्टर साहब, pneumonia हो गया. अच्छा, the sample collected from the blood was subsequently positive, which was showing alpha hemolytic colonies. Alpha बोलते ही आपको क्या याद आएगा? Either they should be pneumococci or they should be viridans. बराबर? Now, on gram staining, these were gram positive, and the suspected pathogen is ऑप्टोचिन सेंसिटिव. अभी हम बताए ना, बियो, बी फॉर बाइल. I for inulin fermentation, O for optogen sensitivity होता है हमारा Streptococcus pneumoniae, not viridans, not viridans, not viridans. Okay, now in the gut, how many anaerobic organisms will be there? Always remember, thousand anaerobes, one aerobe. Gut में पूरा anaerobic without oxygen. A child has a pustular lesion on the leg. Gram staining shows gram positive cocci. And if you want to make a diagnosis that it is a group A streptococcal erythroderma, what is the best test which is available? आपका आंसर क्या होना है? Besidrocin sensitivity. Besidrocin sensitivity is what you should remember. अभी आ गया भैया the life saving differential diagnosis. How will you approach? ये टेबल आपके समझ में आ गए तो ना, if this table comes into the brain, then Dr. Murali Bharadwaj will be heaving in happiness, right? हाँ, gram positive cocci whenever they are there, भैया आप catalase test करेगा. If catalase is positive and you found grapes, grape-like bunches, that is staphylococci. If it is negative, that becomes streptococcus, and now you will grow it on sheep blood agar, and you will see whether it is partially hemolytic, which is alpha, completely hemolytic, which is beta, right? Then once you see whether it is alpha or beta, gamma means no hemolysis, right? No hemolysis. That's what our microbiology teacher tried to teach us. Gamma means no hemolysis, right? Now, alpha and beta में which is partial और एक बार देख लो. Now, beta hemolytic है, then you grow it on besidrocin sensitivity. You look for besidrocin sensitivity. Beta को besidrocin को के पास भिजाते. B for beta, B is sent for besidrocin. Right? Now, alpha hemolytic को कहाँ भिजाएगा आप? ऑप्टोचिन सेंसिटिविटी के लिए अल्फा बोले तो हिंदी में कैसे लिखते हैं? अल्फा. ऑप्टोचिन सेंसिटिविटी बोले तो ऑप्टोचिन सेंसिटिविटी ऑप्टोचिन बोलते हैं ना. सो इसलिए अल्फा को ऑप्टोचिन के लिए भेजो, बीटा को बेसिट्रेसिन के लिए भेजो, बराबर. नाउ if besidrocin is sensitive, it is Streptococcus pyogenes. If the besidrocin is not sensitive, they are the other beta hemolytic streptococci. Similarly, optochin के लिए भी जाओ. Optochin sensitive है तो Streptococcus pneumoniae है. If the optochin is resistant, that is viridans. That is viridans is what you need to remember. So this is the protocol, doctor. और एक बार फटाफट समझ में आ गया ना? You got it intrathecally administered now? Concept intrathecally सीधा दिमाग के अंदर जाके बैठ गया ना? और एक रिविजन नहीं होगा. ग्राम पॉजिटिव कोकाई कैटलिस्ट टेस्ट, पॉजिटिव है तो स्टेफिलोकोकाई, नेगेटिव है तो स्ट्रेप्टोकोकाई. ब्लड अगार में ग्रो करो. अगर स्ट्रेप्टोकोकाई है तो then it can be beta or alpha hemolytic. Beta hemolytic है तो besidrocin, B for B, and besidrocin sensitive है तो Streptococcus pyogenes. Alpha hemolytic है तो O, optochin दोनों है. इसलिए if it is sensitive, it is Streptococcus pneumoniae, and if it is resistance, then it should be viridans. That is what you have to remember, doctor. Chalo. A patient is admitted to an ICU, central venous line for the last 1 week after 7 days of antibiotic, gram positive, cocci in chains, but it is catalase negative. If it is catalase negative, it is streptococci. If it is catalase positive, it is staphylococci. That is what दादाजी ने बताया हमको. Following this, vancomycin was started and the organism continued to grow. वैंकोमाइसिन को परवाह नहीं करने वाला ऑर्गेनिज्म होता है एंटेरोकोकस फीकालिस. इज व्हाट यू नीड टू रिमेंबर. अभी आ गया भैया नॉन हिमोलाइटिक होता है गामा हिमोलाइटिक. गामा hemolytic. Now फटाफट बोलो, what are all the organisms which are gamma hemolytic? जहां hemolysis नहीं होगा, right? So Enterococcus fecalis, इसके पहले इसको ग्रुप डी स्ट्रेप्टोकोकाई बोलते हैं. कितना पहले पूछो मत. 25 साल के पहले, एक क्वार्टर सेंचुरी के पहले, जब मैं माइक्रोबायोलॉजी में सेकेंड ईयर एमबीबीएस में था, काकतीय मेडिकल कॉलेज वारंगल में, तब भी लोग बोलते हैं कि एंटेरोकॉकस फीकालिस फॉर्मली कॉल्ड एज ग्रुप डी स्ट्रेप्टोकोकाई. फ्रॉम देन टिल नाउ आई एम टीचिंग द सेम थिंग, राइट? नाउ दैट इज अल्फा, दैट इज गामा hemolytic. बराबर? नाउ स्टेफिलोकोकस saprophyticus, Staphylococcus epidermidis, these three organisms you have to remember for gamma hemolysis. और एक बार बोलो, Enterococcus fecalis, Staphylococcus saprophyticus, Staphylococcus epidermidis are all non-hemolytic, otherwise called gamma hemolytic. Now, doctor, a child has a pustular lesion on the leg, gram staining is showing gram positive. ग्रुप ए स्ट्रेप्टोकॉकल एरिथ्रोडर्मा बोल के आप एस्टैब्लिश करना है तो अभी अभी पढ़ा है करके ना. बेसिट्रेसिन सेंसिटिविटी विल हेल्प यू. नाउ Lancefield classification, why do you use, doctor? What is the basis of that? Carbohydrate antigen. By mistake आप M protein बोलो, एग्जाम में 10,000 people will walk on your head, right? So not M protein. It is not M protein, it is the basis of the Lancefield classification. It is the carbohydrate antigen is what you need to remember. Now, doctor, with regard to the carbohydrate antigen, what is important point? Carbohydrate antigen has a lower immunogenicity. The memory response is not seen. It causes polyclonal B cell stimulation and it does not require stimulation by T cells. That is the specialty of carbohydrate antigen. By the way, doctor, we have a free live online YouTube hot revision. To which batch do you all belong to? Dr. Murali Bharadwaj, Super 2000 students, self-preparation, Super 2000 students. 14 September आने वाले सैटरडे को 10 AM to 5 PM हम ऑर्थोपेडिक्स का देख लेंगे. ऑर्थोपेडिक्स को, what is orthopedics? After all, there are around 30 boiling topics from which 10 MCQs come. 30 टॉपिक्स को आप गर्मा गर्म रिविजन करके यू शुड ओनली इन्वेस्ट नॉट मोर देन 6 to 7 hours ऑन ऑर्थोपेडिक्स, राइट? आई विल मेक यू एक्सपर्ट्स. महाज्ञानी बन जाएगा आप. 15th September मतलब संडे 10 AM to 5 PM ऑफ्थेल्मोलॉजी 25 मोस्ट हॉट टॉपिक्स का रिविजन करेंगे एब्सोल्युटली फ्री, राइट? यूट्यूब बोले तो फ्री है ना. हाँ, Dr. Murali Bharadwaj anyway is free. All of you know that very well, right? Now, doctor, please come and also ask all your friends to join, right? I'm not fool to say that limited seats are available. Oh, advertisement वाले करते ना. Join our coaching program. Limited seats are available. Limited seats क्या है भाई? कोई आके join हुए तो ज़्यादा seats मंगाते, rent पे लाके seats लगा देते, right? तो लिमिटेड सीट्स अवेलेबल फॉर माय ऑनलाइन प्रोग्राम. किसी को बोलना मत, राइट? प्लीज टेल ऑल योर फ्रेंड्स टू जॉइन दिस वंडरफुल मॉर्निंग टू इवनिंग क्रैश रिविजन सेशंस, राइट? नाउ a 65-year-old man presenting with complaint of chest pain, fever, cough with sputum, and the sputum cells are gram-positive cocci, and the blood agar is showing positivity of the growth. So if you want to differentiate this from other gram positive cocci, matlab pneumococci versus other positive cocci, what is the best test? Bile solubility, bio, reliance ka geo, please don't forget, right? Now Streptococcus cleaves DNA. Streptolysis O is active in reduced state. Streptococcus kinase is produced from the serotypes A, C, K. Some of you are going to become cardiologists now. Streptokinase is produced from serotype A, C, K is what you should remember. And that is the reason if somebody has a prior streptococcal infection, in them you need to be very careful in order to administer the streptokinase. Streptokinase को एक बार दिए तो next time immediately दिए तो problem हो जाएगा because of that immunoreactivity. Now, group A streptococci, how do you want to diagnose? Best test? BO, that is bacitracin sensitivity. Ashcroft body is made up of what, doctor? Lymphocytes is what you need to remember. Now, which organism which is usually sensitive to penicillin? It is the Streptococcus pyogenes. Penicillin के बात सुनेगा. Alexander Fleming को ऊपर उसको रेस्पेक्ट है. Staphylococcus aureus बन गया. MRSA, VRSA, all SA. Staphylococcus aureus resistance is a big issue in the antibiotic sensitivity, right? So that's the reason we have to be carefully using the antibiotics, because Staphylococcus day by day is growing resistant. Initially penicillin, then methicillin, then vancomycin, then imipenem. दुनिया के सारे एंटीबायोटिक्स का रेसिस्टेंट हो गया है स्टेफिलोकोकस ऑरियस. बट स्ट्रेप्टोकोकस पाइजीन्स उन दिनों अलेक्जेंडर फ्लेमिंग के दिनों में भी पेनिसिलिन के बाद सुना. आज भी पेनिसिलिन दे रहे हैं हम रूमेटिक फीवर पेशेंट्स को. इनफैक्ट दैट इज मोस्ट इंपॉर्टेंट पार्ट ऑफ द ट्रीटमेंट डॉक्टर. पेनिसिलिन properly, if you can be able to educate and convince the patient to take the penicillin prophylaxis, you can avoid a lot of valvular heart disease from worsening, right? Now, Draughtsman's concentric rings on culture, they are produced by pneumococci. Neonatal meningitis, group B streptococci is implicated. Scarlet, your girlfriend Scarlett यहाँ है. Scarlet, तेरा फीवर किसके वजह से है? Streptococci. Now, a early detection of Streptococcus pyogenes means you should remember bacitracin, not optacin. Options में examiner will give you optacin. No. Bacitracin for Streptococcus pyogenes is what you need to remember. If you want to make a diagnosis of the Streptococcus pyogenes, infection with Streptococcus pyogenes in a case of rheumatic fever, AS4 titer is most useful, not any other test. Blood culture वो सब बेकार है. AS4 titer is going to be the only way by which you will be able to make a diagnosis of the rheumatic fever's activity. Streptococcus toxin that lead to the connective tissue breakdown. Which one it is? Hyaluronidase. Now, doctor, if you take the various gram-positive cocci, you should remember saprophyticus lead to UTI in the females. Micrococci are oxidase positive. Most enterococci, they are all resistant to penicillin and many other penicillin congeners. Pneumococci are capsulated is what you need to remember. Now, doctor, capsular hyaluronic acid component of the Streptococcus pyogenes. It is that which is cross-reacting with the synovium in the human tissues. Our immune system is thinking Streptococcus pyogene and our joints are same, because capsular hyaluronic acid of the pyogenes, that is the one which is cross-reacting with the synovium of the human tissues. Now, doctor, Enterococcus. You have Enterococcus fecalis, Enterococcus faecium. It can lead to peritonitis. Universally, पूरे दुनिया में अमेरिका जाओ, लंदन जाओ, कहीं भी जाओ, resistant to penicillin. That is Enterococcus. And it is a cause of the intra-abdominal abscess. One more important thing. Whenever endocarditis, okay, is caused by enterococci, what do you need to give? खाली पेंसिलिन दिए तो काम नहीं चलेगा. You have to combine aminoglycoside plus penicillin. That is the point asked by the examiner. Now, a child presents with sepsis. The bacteria isolated shows beta hemolysis on blood agar. There is a resistance to bezitracin, but it is positive for the CAMP test. Christy Atkins Munch Peterson test को CAMP test कहते हैं. What is that organism likely to be? That is Streptococcus agalactiaceae. The CAMP test is greatly helpful to differentiate Streptococcus agalactiaceae from the Streptococcus pyogenes is what you need to basically remember. अच्छा, 2-3 शब्द CAMP test के बारे में रिविजन हो जाए. CAMP test positive means Streptococcus agalactiaceae, negative means the Streptococcus pyogenes. Because agalactiaceae produce CAMP factor. What is CAMP factor, doctor? It is a diffusible extracellular protein which will synergistically act with the beta lysine of the Staph aureus and it will enhance the lysis of the RBCs. That is the story. So, एक CAMP test करने के लिए आपको Staphylococcus aureus भी लाके CAMP अगर organism agalactiaceae है तो then the beta hemolysis, the lysis of the RBCs will be more. That is what you need to remember. Now, a patient has signs of pneumonia. Bacterium obtained from the sputum was gram-positive cocci and it is showing alpha hemolysis on the sheep agar. Now, alpha hemolysis is there. How do you want to confirm that it is Streptococcus pneumoniae? Bio. Reliance ka Geo. Bile solubility, inulin fermentation, optogen sensitivity. They all will say it is pneumonia, is what you should remember. So, always remember, doctor, if you want to differentiate beta hemolytic streptococci, what are the 2 beta hemolytic streptococci? Pyogenes and agalactiaceae. They are the beta hemolytic streptococci. You can remember. अरे बाप बोलते ना, अरे बाप क्या होता है? B for beta hemolysis, A for agalactiaceae, P for pyogenes. ठीक है? Now, if it is pyogenes, it is susceptible to bezitracin and CAMP is negative. So, bezitracin and CAMP. B-CAMP, very famous B-complex brand. B-CAMPools, right? B-CAMP. So B होता है bezitracin sensitivity CAMP test. These are the things to differentiate. Streptococcus pyogenes, susceptible to bezitracin, CAMP negative. Streptococcus agalactiaceae, typically it is resistant to bezitracin but positive to the CAMP is agalactiaceae. You will not forget, right? Now, how do you differentiate alpha hemolytic streptococci, doctor? What are alpha hemolytic streptococci? Viridans and pneumoniae. Alpha means viridans, that concentric circle, and V. जरा यहाँ V को ऐसा पलटो, right? ऐसे V को ऐसे पलटो. So, pneumococci versus viridans. If it is Streptococcus pneumoniae, it is optogen sensitive and bile soluble inulin fermenta. So, bio is the one which will basically differentiate. Now, doctor, अरे हम तो चैंपियन बन गए, ग्राम पॉजिटिव बोले तो बहुत बड़ा स्टोरी समझे, इतना छोटा स्टोरी always will be very little, doctor. Only thing is you have to catch it up. What examiner is exactly trying to hold your ear. Pneumococcus, the capsule of it helps in virulence. Pneumococcus, commonest cause of the otitis media. Pneumococcus can lead to meningitis. Pneumococcus, respiratory tract of carriers is most important source of infection. You give a French kiss, you put your nose into somebody's nose, then pneumococcus will come. Now, doctor, a 8-year-old child with a history of pain and discharge from the right ear, that itself will tell it is otitis media. With the fever, with neck rigidity, positive Kernicks, and gram stain shows the gram positive. Then what is the organism? You will be answering in the tomorrow's exam, pneumococcus. You will jump and answer pneumococcus. So what are all the organisms with the polysaccharide capsule, doctor? Pneumococcus, meningococcus, Haemophilus influenzae. That is the reason we try to give the pneumovac, meningovac, HVAC. A newborn, when he is born, no, so many vaccines we have to give to him. Now, doctor, C in C-reactive protein क्या होता है? Capsular polysaccharide in the pneumococcus. C is capsular polysaccharide in the pneumococcus in the C in C-reactive peptide. It's C-reactive peptide. Now, doctor, a 5-year-old child, pustular lesions on the lower legs, culture is showing hemolytic gram-positive cocci, provisional diagnosis of group A streptococci, pyoderma. How can you make it? It is the bacitracin sensitivity that will help you to make that, oh, this is group A, streptococcus associated pyoderma. Quellung reaction is typically positive in the case of the pneumococcus, and bile solubility. Why do you use it? To differentiate what and what is the examiner's question. Pneumococci from streptococci. Pneumococci from other streptococci. Now, most common organism causing upper respiratory tract infection in adult hota hai Streptococcus pyogenes. After splenectomy, most common infection is pneumococcal. Streptococcal toxic shock syndrome is erythrogenic toxin. Dental caries is caused by Streptococcus mutans. And the most common organism leading to meningitis is pneumococcus. Glomerulonephritis in streptococcal infection is diagnosed by the ASO titer, not throat culture, not blood culture, is what you should remember. Antigenase B is useful for the diagnosis of the streptococcus. Group A streptococcus from other beta hemolytic streptococci, you are going to remember bacitracin sensitivity. Finally, doctor, gram-positive catalase negative cocci means you are going to answer in the exam pneumococcus. Bile esculin agar is the one which will help you to make a diagnosis of Enterococcus infective endocarditis after tooth extraction is because of bile esculin agar is used for the Enterococcus. Now, infective endocarditis after tooth extraction is Streptococcus viridans. That is our quick story. 10 points about Streptococci. Definitely without Streptococci, NEET PG entrance nahi hoga. That is what I can guarantee. Today you made insurance for one mark. Happy? Now, doctor, please don't forget, live online YouTube hot revision session. 14th September को 10 AM to 5 PM ortho. 15th September, that is Sunday को 10 to 5 PM will be Aftal YouTube live broadcast. So please ask your friends, you also come, enjoy the session, and this is Dr. Murli Bharadwaj, your everyday classmate, until you get the top rank in the NEET PG. Thank you very much.